Hey everybody, so today we're going to be talking about the final synthesis case study, which is in regard to the Little Health System. We're going to be going over analysis of the data, their operational issues, financial issues, as well as recommendations for long-term and short-term that I can foresee would help this system out. So we're just going to get started into that. So for the Little Health System, it's divided into clinics. So we have an on-site clinic and then off-site clinics. There are a total of 3 on-site clinics and 1 off-site clinic. So we're going to be talking about the on-site clinic first in the Little Ambulatory Service Center. So, like I said, there's 3 ambulatory clinics, but of the available space, only 67% of the space is being used based on the number of exam rooms that they have, as well as the number of doctors and nurse practitioners that are hired. In regard to one of the clinics, there is a 10-bed design, which is used to be a procedure center. So they have 10 beds. All beds are designed to be procedure rooms, but the beds only run at about a 70 to 80% occupancy, primarily due to the nursing shortages. This is because most of the procedures require nurses to be present. So if they're having a limited number of staff available, meaning that the nurses, they're not going to be able to perform the maximum amount of procedures. That's why they're only seeing between 70 and 80% occupancy with these rooms. Okay, so another, further data analysis. In effort to reduce their cost, 2 years ago, this on-site clinic changed their skill level to a mixed skill level, meaning they would have some registered nurses and then they would have some nurses' aides. This also required patients to be seen at a longer time in the clinic than previously. Visits per day had dropped from 117 visits to 97 visits a day, and the scheduling had been affected, meaning that patients were waiting on average 63 days to have an appointment. Because of this, because of the increased wait time in the clinic itself, because it takes longer to have an appointment booked, these patients are now choosing the better clinic system instead. Another huge part of this data analysis in regard to the on-site clinics is that 20% of their nurses annually are switching jobs, which is huge because if you have nurses quitting 20% of them annually, you're constantly losing staff, meaning you're not going to be able to see as many patients as you once were. Okay, so now we're going to get on to the off-site clinic, which was created 5 years ago for the uninsured and the underinsured residents of the area. So on average, this clinic is able to see 37 visits per day. Only 90% of the visits are filled up, so I did the math myself. That would mean that they would be allotted 48 visits per day total if they were able to take 100% of the patients that they could see. So 48 visits per day, yet they're only able to see 37. This clinic was created primarily from funding for charitable foundations, so any loss that this off-site clinic is seeing is primarily due to the lack of funding. RNs continue to work there. They provide the best patient care, and at the off-site clinic, you're going to see that the patients have a 94% satisfaction rate, which is really good for these types of areas and clinics. In regard to advanced healthcare providers, 50% of patients are seen by a medical doctor and 50% are seen by a certified registered nurse practitioner. So that's a little bit of the data analysis in regard to the on-site and the off-site service center clinics. So now we're going to be able to talk about the different operational issues that I can see in both the clinics, on-site and off-site. So the first operational issue set that we're going to do and talk about is the on-site clinics. So staffing is huge. If you don't have enough staff, you're not going to be able to see enough patients that you want to see. So in the on-site clinics, it's saying that they're only able to see 70 to 80% of their rooms being occupied due to their lack in staff. So if you had an increased number of staff, you're going to have an increased number of patients that are going to be able to be seen. Another huge operational issue is the appointment wait times. If you have a patient who is sick, who needs to have lab work drawn monthly, they can't wait 63 days for an appointment, which is the average wait time for an appointment at the on-site clinic, which is huge. 63 days, that's over 2 months. A lot of people are not going to be able to book 2 months in advance for their appointment times. Therefore, they're going to find a health system that can take them at a quicker time and at a more convenient time for them when they need to be seen. Another operational issue that I can foresee based on the data is the skill mix change. So 2 years ago, the clinic used the skill mix change as a result of wanting to cost reduce the number of, or the amount of money that they were paying to employees. However, they're having issues if you have a registered nurse that's being outstretched, doing far beyond their call of duty, and then you have a nurse's aide who isn't doing as much, isn't providing as much care to the patients. It's going to be hard, and you're going to have some feuds, which is a big operational issue. In any workplace, whether it's a business, whether it's another kind of industry, if it's the food industry, the healthcare services, if you don't have good team players and if your team doesn't have an overall goal to provide the same amount of care or whatever it may be, your system and your industry is going to lack, which this seems to be a huge downfall to the on-site clinics. Okay, so now we're going to look at the off-site clinic operational issues. So based on the data that I was given in my attachment, it looks like only 90% of the visits that they offer are booked. This is based on the available space and staffing. So an operational issue for the off-site clinic would be that the total number of visits are not being done due to their staffing ratios. So if you had an increase in staff, you're going to have an increase in people available to take patients and see patients per day. Another huge operational issue with this clinic in particular is the transportation or lack thereof. As I mentioned previously, the off-site clinic was developed 5 years ago for patients who were underinsured or uninsured with healthcare insurance, which these patients tend to lacking transportation to their appointments. So this is a huge operational issue. One of the last operational issues that I can see based on the data in the off-site clinic is their underdeveloped clinic overall. Healthcare is something that makes people feel so vulnerable. A lot of people are scared to go to a doctor's office. A lot of people don't want to go to a healthcare clinic. It's not, typically something that people enjoy doing. So it makes you feel vulnerable. So if you have a clinic that's underdeveloped, it's not well furnished, you feel like you're not being waited on appropriately at an appropriate time, or you feel like when you're waiting for your appointment, you can see other people in the appointment rooms. I know they mentioned that there was a 14-year-old pregnant girl that somebody could see, and then there was another man who was in respiratory distress. Healthcare is so much based on privacy, and if your clinic can't accommodate patients' privacy, patients aren't going to want to go there. So that's a huge thing, in my opinion. Okay, so now we're going to look at a little bit of the financials that both the on-site and the off-site clinics are having. So, as you can see, both of them are lacking in finances. There's a limited number of staff available for both, which means that less patients are going to be able to be seen. The problem with this is you could staff 2 registered nurses to take care of 20 patients. However, the time that it would take to see each patient would make each patient wait more. So if you had more of an equal number of staff to patients, or at least a little bit more of a equal ratio, you're going to have happier patients. You're going to have patients being seen better. You're going to take better care of them. They're going to want to come back to your clinic. So that's huge. Part of their financial issues is their lack of available staff. Another huge problem is that healthcare systems find nurses to be expensive. They don't want to pay a nurse when they could pay a nurse's aide. But the problem is the patients prefer to see the nurses. The nurses take more time. They've gone to school longer. They take more time to the patient, which is seen on the offsite. They have a 94% satisfaction rate, and they are only staffed by registered nurses, medical doctors, and nurse practitioners. So this is something huge in regard to nursing compensation. If you compensate a nurse for the work they do, they're going to, 1, want to do the work, and 2, they're going to want to stay at the job. So based on my short-term recommendations in regard to financial management, like I had mentioned, the nurses being perceived as expensive, that's, a reason why many healthcare systems think, oh, if we want a cost reduction in our overall spending, we'll just take away some of the nurses. That's not really going to work. It's not a true financial cost reduction. So my recommendation would be to increase the number of RNs working in the clinics. The patients like the RNs like the patients. They want to give care to the patients. They want to do patient care. The problem is you need to compensate the nurse directly related to their productivity and what their call of duty is. So the more compensated the worker, the harder the worker will work, and the more work they will do. For long-term recommendations, this is something that is relatively new to healthcare. It's something that I myself recently had read about within the past 6 months, but that's transportation for healthcare systems. So I know that Lyft drivers and Uber drivers, a lot of them are teaming up and partnering with healthcare companies to provide patients with access to their transportation to and from their appointments. And this is huge. If you think about it, I'm going to just do a little example. You have a patient. She has raging hypertension. She's seen by a physician on a 3-monthly basis to kind of tweak her meds a little bit. The past few appointments, she's not been able to show up. So her hypertension is uncontrolled. She's not able to fill her prescriptions because she hasn't been seen by a physician. Now, you have that patient. She's missed 6 appointments. She now has a stroke based upon her horrible high blood pressure because it was left untreated, because she was unable to get herself to her appointments. So this is something huge that I think in regard to the off-site clinic that is for the underdeveloped and underinsured residents of the area, that it would really improve the number of people that are able to get to their appointments, because they're going to have an increased transportation. So that's something that I think is something that healthcare systems really need to take seriously and really need to look at in regard to their data analysis. Okay, now we're going to talk about the cost-saving plan for both types of clinics, the on-site and the off-site. So if we look at the on-site finances, they hire registered nurses for $21 an hour and nurses' aides for $12 an hour. we look at the differential of who's hired, registered nurses, 33% of them are hired, and 66% of the on-site clinics consist of nurses' aides. On the other hand, you have the off-site finances. So the registered nurse makes $26 an hour, which is on average $5 more than the on-site clinic's nurse makes. This off-site clinic is also staffed 100% by a registered nurse. So if you're looking at your cost-saving plan, it looks like, so now if we look at the cost differential, you can see that the on-site staffs 4 registered nurses, and they staff 8 full-time nurses' aides. So if you calculate based on their salary, so the nurse makes $21 an hour, the nurse's aide makes $12 an hour, that on-site clinic is spending roughly $180 to staff the nurses and the nurses' aides. They're also having 20% of their nurses leave annually. They're not having good patient satisfaction as patients are going to another health system instead of theirs. And you're having conflict between the nurses and the nurses' aides based on who's doing more work and who's getting compensated more and better. Well, if you look at the off-site clinic staffing, they staff full-time registered nurses at a rate of $26 an hour, which means that clinic is spending $104 on their nurses, compared to $180 for the on-site finance. You're looking at $104 for the off-site finance. So you're spending less money by hiring the registered nurses, and you're having a higher patient satisfaction. It also looks like, based on the data that I can see in the reading, that the off-site clinic nurses are not leaving their jobs as frequently as the on-site nurses. Therefore, they're having a higher patient satisfaction, and they're having a higher nurse satisfaction, which makes the nurse want to do better work. Also, for the off-site clinic, I think that in regard to the littering, the trash, the harshly unfurnished area, the graffiti on the walls, it's not what patients want to see when they come in to get healthcare treatment. So, just like any other business, healthcare is a business in itself, and if you want to start a business that's going to be successful, you're going to want to invest your money into the look of your clinic in order to create a better revenue and increase the number of patients that want to be seen there. I know personally, as a patient, as a nurse, I would not want to be seen at a clinic that looked very underdeveloped, especially in healthcare. It's just not something that I want to see. So I know there's a lot of things that go into healthcare services, running clinics and revenues and all of that information, but in order to provide the best patient care, you're going to want to provide the best workers to do so. So there are many, many ways that I could think of on how to have you better budget your clinics, but these are just some ways that I think that you will have more success with your health plan and your health system, and your patients will want to be seen there and not to look at other systems for further care. I wish success to your healthcare team and your system. If you need any further information, if you have any other questions, please feel free to contact me. I'm always willing to help. Thank you. Bye.